At the Ministry of Manpower's Assurance, Care and Engagement, ACE Group, we support the well-being of our migrant workforce. In ACE Group, we want to give migrant workers the assurance that they will be taken care of as they begin working in Singapore. Their journey begins in the onboard centre, where newly arrived migrant workers undergo medical screening and a settling-in program that prepares them for life in Singapore. During the settling-in program, migrant workers learn about basic employment rights as well as Singapore's social norms before leaving and heading to their place of residence. We are enhancing housing standards to improve the livability and resilience of housing for our migrant workforce. From purpose-built dormitories to residential premises, ACE Group reaches out to migrant workers living in various types of housing to support their essential needs. ACE Group works with stakeholders such as dormitory operators to maintain infection prevention and control measures for dormitory residents.
Dorm operators like ourselves, we work with the ACE and FAST team on the ground to find solutions as to how we can create a better living environment for the migrant workers. We visit the dormitory rooms to understand better from the migrant workers what are their challenges and how we can make things better for them. We want to be able to eventually create a living environment. They come back to a place where it's more welcoming and sufficient.
Working together with our partners, we seek to ensure a basic standard of living for each of our migrant workers, assuring them that they will be well taken care of in Singapore. In ACE Group, we care for our migrant workers by ensuring they have access to primary health services. In April 2022, we rolled out the Primary Care Plan for migrant workers so that our migrant workers have access to quality, affordable and accessible healthcare. Medical centres providing primary healthcare services are conveniently located near migrant workers, and they are complemented with telemedicine services.
For workers who are unwell or injured and require hospitalizations, the nursing team will visit them upon discharge to assess them on their health needs and recovery progress. Some of the migrant workers are trained to spot on the early sign of distress of their co-workers or even friends, and they can link them up to the counsellors when needed.
From routine checkups to preventive care, post-hospitalization care and mental health, every migrant worker has access to healthcare support. Engagement lies at the heart of ACE Group's work. We want our migrant workforce to stay socially connected through recreational activities in dorms, within the community and at the recreation centres. At the recreation centres located island-wide, migrant workers not only visit to enjoy meals and shop for their daily needs, they can also participate in a range of activities including sports, events and courses organised by MOM, NGOs, youths and community partners. These recreation centres are places for them to relax, connect with one another and keep themselves active.
NWC has established its partnership with ACE since its establishment during the COVID period, where we jointly assist migrant workers in handling some of the issues they face at the dormitories as well as their workplaces. As an NGO partner to ACE, we have benefited tremendously from this partnership, and we strongly encourage all NGOs to join us in this collaborative movement so that we can collectively do more for the community that we truly care about.
As a friend of ACE or FACE volunteer, we work with the ACE to provide support for fellow workers. I also volunteer at an event organized by the ACE and appreciate the efforts in caring for our well-being.
In partnership with our stakeholders, we aim to develop a migrant workforce that is productive, cared for and appreciated by the community.